Welcome to Doctor Health Hub, where every episode begins with a doctor tip you can trust. Today we're talking about something many people experience but often ignore: heel pain. It may sound like a small problem, but if you've ever felt it, you know it can make walking uncomfortable, limit your daily movement, and even affect your mood. For many people, the pain starts first thing in the morning. They take that first step out of bed and feel a sharp, stabbing pain under the heel, like stepping on a stone. So why does this happen, and what can we do about it? Doctor, many people say, I didn't fall, I didn't injure my foot, but my heel suddenly started hurting. Why does heel pain happen even without injury?
That's a very common question. Most heel pain doesn't come from a sudden accident. Instead, it develops slowly over time due to strain and overuse. The number one cause is something called plantar fasciitis. That may sound complicated, but it's simple to understand. Under the bottom of your foot, there is a strong band of tissue called the plantar fascia. It connects your heel to your toes and helps support the arch of your foot. When this tissue becomes irritated or overstretched, it causes pain. That's plantar fasciitis.
So heel pain is usually not from a broken bone or a big injury. It's more of a stress problem from daily movement.
Exactly. Studies show that more than 80% of heel pain cases are caused by plantar fasciitis. But it doesn't just appear for no reason. There are specific causes and risk factors that trigger it, and once people understand those, it becomes much easier to treat heel pain correctly and prevent it from coming back.
Let's break that down. What actually causes this strain in the heel? Why do so many people develop heel pain even if they don't play sports or have an injury?
Heel pain usually builds up slowly over time. There are several reasons why it develops. People who spend long hours standing or walking, like teachers, nurses, factory workers, cashiers, or chefs, put constant pressure on the heel. People with flat feet or very high foot arches are also more likely to develop heel pain because their feet don't absorb pressure evenly. Wearing flat shoes or unsupportive footwear like flip-flops or soft bedroom slippers can also strain the heel. Another major factor is tight calf muscles, which pull on the heel during movement.
So footwear and foot structure play a very big role.
Absolutely. The wrong shoes can cause more harm than people realize. On top of that, sudden weight gain or overweight conditions also increase pressure on the heel. And as we get older, especially between the ages 40 and 60, the plantar fascia naturally gets weaker and less flexible. That's why heel pain is more common in middle age. But it can happen to younger people too, especially runners or athletes.
So, to put it simply, overuse, long-standing, poor footwear, flat feet, tight muscles, weight gain, and aging are the major causes of heel pain.
Exactly. Heel pain is not random. There is always a reason behind it, and once you understand what's causing it, you can fix it step by step.
Let's talk about symptoms. How does heel pain usually feel, and what signs should people pay attention to?
The most common symptom is a sharp stabbing pain under the heel, especially with the first step in the morning. Many people say it feels like stepping on a stone or a nail. The pain may get better after a few minutes of walking, but it often comes back later in the day, especially after long periods of standing or after sitting for a long time and then walking again.
So, movement can make it feel better at first, but too much movement brings the pain back again.
Exactly. Another typical symptom is pain after exercise, not during it. Someone might be able to walk or run, but the pain appears after activity once the foot rests. Some people also feel stiffness in the heel or a pulling sensation along the bottom of the foot.
Does heel pain usually affect just one foot or both?
It can be either one. Most people feel it in one heel, but in some cases, especially people with flat feet or long-standing jobs, it can affect both heels. The pain usually stays under the heel, but it may sometimes extend toward the arch of a foot.
If someone goes to a doctor for heel pain, how do you confirm that the problem is plantar fasciitis or something else? Do people need an X-ray or MRI?
In most cases, no scan is needed. Heel pain, especially plantar fasciitis, is usually diagnosed based on symptoms and a physical examination. A doctor will ask where the pain is, when it started, what makes it worse, and whether the person spends long hours standing or wears flat shoes. Then during the exam, the doctor will press on specific points under the heel. If the pain is strongest at the spot where the plantar fascia attaches to the heel bone, that is a classic sign of plantar fasciitis.
So, diagnosis is usually simple based on the pattern of symptoms.
Exactly. Most of the time, imaging like X-ray or MRI is not necessary. However, a doctor may order an X-ray if there is concern about a stress fracture or an ultrasound if we need to check for tissue changes. But for the majority of people, a scan is not required. The diagnosis is clear from symptoms and examination alone.
Earlier you mentioned that plantar fasciitis is the most common cause of heel pain, but not the only one. What other conditions do doctors consider before confirming the diagnosis?
That's an important point. Even though most heel pain comes from plantar fasciitis, we always make sure it's not something else. So we briefly consider other possible causes such as Achilles tendonitis, heel spur, bursitis, stress fracture of the heel bone, tarsal tunnel syndrome, nerve compression, gout, rheumatoid arthritis, heel pad syndrome, and in rare cases, infection or tumor. We don't need to go deep into each of them now, but we always think about them during diagnosis. The location of the pain and the pattern of symptoms help us tell the difference. For example, pain behind the heel is more likely Achilles tendonitis, while burning or tingling may suggest a nerve problem. If the pain started after a strong injury, we think about a stress fracture. That's why a proper evaluation is important. Not every heel pain is the same.
Before we move to treatment, are there any danger signs people should watch for? When is heel pain a sign of something more serious?
Most heel pain is not dangerous, but yes, there are some red flags that should never be ignored. If any of these are present, the person should see a doctor quickly. Heel pain after a fall or accident, severe pain that makes it hard to put weight on the foot, heel pain with swelling, redness, or warmth, numbness, tingling, or burning sensation, fever together with heel pain, sudden heel pain with calf swelling could signal a blood clot, or pain that does not improve at all after 4 to 6 weeks of proper treatment. These warning signs may suggest something more serious than plantar fasciitis, such as a fracture, nerve problem, infection, or systemic disease. So if any red flag appears, it's important not to ignore it.
Now let's talk about what most people really want to know. How do we treat heel pain safely and effectively?
The good news is that most cases of heel pain can be treated without injections or surgery. The key is to reduce pressure on the heel, calm the inflammation, and help the plantar fascia heal. We follow a simple step-by-step plan that works for most people at home.
So what should someone do first when heel pain begins?
We usually start with conservative treatment, simple things that really work. Here's a clear plan. 1. Rest and activity modification. Avoid long periods of standing, running, or jumping. The foot needs time to recover. 2. Ice therapy. Roll a frozen bottle of water under the foot or apply an ice pack for 10 to 15 minutes, especially after activity. 3. Stretching exercises. Daily stretching of the plantar fascia and Achilles tendon is one of the most effective treatments. Just 2 to 3 minutes daily can help. 4. Proper footwear and heel support. Avoid flat shoes and slippers. Use cushioned shoes with arch support. Heel cups or gel insoles reduce pressure on every step. 5. Pain relief if needed. Short-term use of ibuprofen or other anti-inflammatory medicine can help, but it should not replace physical treatment.
So treatment is not just about pain relief, it's also about correcting the cause.
Exactly. If people only take medicine but continue wearing flat shoes and don't stretch, the pain will definitely come back. That's why habits must change. In stubborn cases, doctors may also recommend physical therapy, night splints, or shockwave therapy. Injections may be used only for severe pain, and surgery is very rare.
Once someone improves from heel pain, how can they prevent it from coming back again?
Great question, because heel pain can return if we don't fix the habits that caused it. Prevention is simple and practical. Wear supportive shoes in daily life, avoid flat slippers and thin sandals, Never walk barefoot on hard floors for long periods. Stretch your calves and plantar fascia daily. Even 1 minute helps. Use arch supports or orthotic insoles if you have flat feet. Maintain a healthy weight to reduce pressure on the heel. And warm up before exercise and increase activity gradually. Replace old worn-out shoes regularly. With these small lifestyle changes, most people prevent heel pain from returning.
Before we close, can we give a simple summary for everyone watching, something they can easily remember?
Absolutely. Here's heel pain in a clear, simple summary. Heel pain is most commonly caused by plantar fasciitis, which happens when the thick band under the foot becomes overstretched and irritated. It's usually due to overuse, long hours of standing, poor footwear, tight calf muscles, flat feet, or extra body weight.
The pain is usually sharp with the first step in the morning and may return after rest. Most cases do not need x-rays and can be treated at home with rest, stretching, proper footwear, ice, and heel support. But red flags like numbness, swelling, fever, injury, or pain that doesn't improve need medical attention.
So, heel pain is common, but in most cases, it can be treated safely with the right approach.
Exactly. Don't ignore heel pain, but don't be afraid of it either. Take care of your feet, choose the right shoes, and recovery will follow.
Thank you for watching Dr. Health Hub, where every episode begins with a doctor tip you can trust. If heel pain is stopping you from enjoying your daily life, take action early. Simple steps can make a big difference. Take care of yourself, take care of your family, and remember, your health is your wealth. Stay safe, stay healthy, and we'll see you in the next episode with another doctor tip you can trust.